Good evening from New York. The Senate Finance Committee, chaired by a Democrat, populated with a majority consisting of Democrats, has not only crafted a bill that carefully improves the conditions of the insurance monopolies, but has tonight added that little touch of medieval punishment so familiar to the customers of the insurance monopolies. In our fifth story, the Finance Committee debating not merely making buying insurance mandatory under threat of fine, but making it mandatory under threat of criminal penalties. Buy their health insurance unregulated at their prices or go to jail, courtesy Max Baucus. To paraphrase my grandmother, I suppose I have no choice but to let you jam the umbrella up my backside, Senator Baucus, but you are going to have a fight on your hands when you try to open it. The Senate Finance Committee tonight passing a token amendment by Senator Cantwell of Washington that would enable states to form their own public options, maybe, but it would be limited to people with incomes between 133% and 200% of the federal poverty level who do not get insurance at work. Chairman Baucus claiming to have the votes to move the whole bill out of committee when it comes to a vote possibly sometime next week. Senate Majority Leader Reid still to decide whether to include a real public option in the final legislation, stating today he favors a public option, that he's going to do his very best to have a public option, but to remember a public option is a relative term, as is the phrase chance of re-election. No similar uncertainty in the House, where Speaker Pelosi has said a public plan will be in the final bill that goes to the floor, and where Minority Leader Boehner today proved he knows next to nothing about anything.
I'm still trying to find the first American to talk to who's in favor of the public option, other than a member of Congress or the administration. I've not talked to one. And I get to a lot of places, and I've not had anyone come up to me. I know I'm inviting it, but I've not had anyone come up to me and lobby for the public option. This is about as unpopular as a garlic milkshake.
Mr. Boehner needs to get out of the tanning salon more often. A recent poll from the folks at Quinnipiac University shows that voters in Boehner's own state, that's Ohio, sir, in case you've forgotten, support the idea of giving Americans the option of buying health insurance from either a government-run plan or from private insurers. That's what's called an option. And in the latest NBC News poll, when respondents nationwide were asked how important they felt it was to give people a choice of both a public plan and a private plan, 73% of those surveyed considered that choice important. And there is this postscript, quote, a member of Congress walked in and was generally walked right back into a physician's office. We're not there to put on Band-Aids. We were there to make sure that everything possible could be done to preserve that member of Congress. That quote from a former staff physician of what is called the Office of the Attending Physician to ABC News. Those who continue to threaten the first real chance at health care reform, it turns out, have something akin to a high-tech, low-cost, modern community hospital on site at the Capitol. Examinations, including x-rays and lab work, physical therapists, nurses, and a pharmacy, as well as access to the best specialists in the country who are brought to the Capitol. And the cost to the congressmen and senators each year, $503. Not that any members who hadn't paid got turned away. Lots to talk about tonight with Howard Fineman, senior Washington correspondent for Newsweek magazine. Howard, good evening.
Hi, Keith.
So, any Americans who might end up in jail because they didn't buy private insurance under the Baucus bill, should it become law, would I suppose they would then get public health care in jail. Does that make them the only Americans under this plan who would get free public health care or even subsidized public health care?
Yes, Keith, and they would get all the garlic milkshakes they could drink. I think it's the thing about what's the care that they get on the Hill. It's interesting. It's the result of competition. It's the result of choice, which is the key word in that in those polls you were just showing.
I don't suppose it needed pointing out that this idea that you could make it, instead of just making it a fine, you make it actual jail time, even nominal jail time, that has been lobbied for by the healthcare industry in this whole process, correct?
Well, yes, and Keith, the amazing thing here is that if this goes according to the Baucus plan as it now stands, the federal government will require and force the health insurance companies to get tens of millions of new customers, and the pharmaceutical companies to get a lot more business in exchange for some federal regulation. Let's say that, because there technically isn't any right now, but not the one thing that they fear, which is competition. It won't be required really by restructuring the way markets in many cities and regions work, where there's very little private competition. And, of course, it won't require the public plan, the public option, which would be the other main way to force competition. So the way things are going right now, the industry gets just about everything it wants with minimal pain. That's basically what the Baucus plan is.
But this one aspect of this, Howard, how does any lawmaker in his right mind believe that they can get any kind of public support for a provision that puts people in jail for not buying slightly regulated and still not financially regulated in terms of how much you're getting back, or you know what we're talking about here. How are you going to sell this, and how is there going to be a signing ceremony? Isn't it just going to be, wouldn't the President of the United States basically have to write it down and then run to avoid the citizens who had voted for him?
Well, I talked to a couple of members this evening about this, and they were shaking their heads, because unless it's a Machiavellian plot to further raise the visibility of the birthers and the teabaggers, because it plays right into the argument, and it's resonated some out there in the country, into the argument of people who are saying that this is a massive government plot to take over your whole life. I mean, if you were going to try to feed that paranoia among people who oppose this, there's no better way to do it than this. It's crazy.
Who brought this up? Who was the idiot who brought this up? You know?
I wish I knew the answer, and I'll put it on the internet as soon as I figure it out.
All right, send me an email. The Cantwell, we know the state public option idea is from Senator Cantwell of Washington State. Is it window dressing? Is there something to it? It seems awfully qualified and caveated to death.
Well, I think qualified and caveated to death is what a public option is going to be in the end. I think there'll be some whiff of public option, you know, some seasoning of public option, you know, a garlic smell of public option in the final legislation if it's going to pass, because it won't, whatever comes out of conference, if something comes out of conference, won't pass the House of Representatives on final passage unless there's some nod in the direction of a public option. And the Cantwell proposal is one of the first efforts to try to get to that. It'll be some murky language like that, otherwise they won't pass anything.
It's beginning to look like a viable option. Our own Howard Feynman of Newsweek magazine, and if this passes, I will lead the teabaggers. Great, thanks, Howard.
Okay, thanks, Steve.